You are in OBG department. Jenny, 18, presented the hospital complaining of left iliac fossa pain. Left iliac fossa pain. She has come with 6 weeks of amenorrhea. Right, so pregnancy test has been done and is positive. So she is pregnant. The patient is pregnant. Patient has got left iliac fossa pain. Right, looks like ectopic might be ectopic pregnancy. Might be abortion as well. Maybe simple miscarriage, not abortion. I mean miscarriage. It might be. It's 6 weeks of amenorrhea. So you have to see. So take history and management points. Let's have a look. Ectopic pregnancy. What we can have in ectopic pregnancy: tummy pain. It's a left or right iliac fossa pain. Bleeding is important. Nausea, vomiting, and you may have pain at the tip of the shoulder as well. That we will see in ectopic pregnancy. Phrenic nerve, that's the reason. So tummy pain, bleeding, nausea, vomiting. That is very, very important. And of course, pregnancy test is there, which is telling us she is pregnant. Right, and what are the risk factors for ectopic? One is IUCD usage. So if the patient is on Mirena coil or IUCD like Copati, the reason of pregnancy, ectopic pregnancy are high. So that is very, very important reasons. Right, previous ectopic, if there is a history of previous ectopic, that is very, very important. Multiple sexual partners, and if the the patient was treated for STI, PID previously, all these things will increase the chances of ectopic pregnancy. Maybe not for this lady, she's 18 only. If there is someone who is older, maybe like say 35, 40 years old, coming with the same history, we can ask if the patient has got any surgery. Any surgery we are talking about, for example, if the surgery for contraception related thing like permanent sterilization. If you reverse the permanent sterilization for a female, the chances of ectopic will become high. Right. First of all, the reversal of contraception, permanent sterilization is not covered by NHS, but under certain circumstances we might have to do it, and in that case, that's also one of the reason for ectopic pregnancy. So we have got IUCD usage, we have got previous ectopic, multiple sexual partner, STI, PID. All these things will increase the chances of ectopic pregnancy. Right. And routine blood, that is the investigation, and urine investigation, of course, ultrasound to see the product of conception, and beta HCG. That is very, very, very important. High density mole and beta HCG is must, that we will be doing in this scenario. In terms of examination, we have got general physical examination, we have got vitals, and of course abdomen examination, as she has got tummy pain. Right, so these are the things we definitely have to do. So ectopic pregnancy, if you're thinking, patient will be having pain in the tummy, bleeding, nausea, vomiting, pain in the tip of the shoulder. And bleeding, whenever somebody has got bleeding, make sure you're asking for anemia as well. Right, signs of anemia like tiredness, dizziness, and palpitations. Right, so we're not missing these things. And we need to elaborate about the bleeding. How much is the bleeding? And whether there was clots in the bleeding, is it fresh blood or not? All these things we have to ask. Right, and we need to see like nausea, vomiting, how severe it is, how much it is, and depending on that we'll see if patient is able to take the thing orally or not, because we need to keep this patient in the hospital, and we'll be starting the patient on IV fluids as well. Right, so that is very, very important. And we need to elaborate all the symptoms, and then the treatment is, first is symptomatic treatment, like if the patient has got nausea, vomiting, we'll be treating the patient for that. If the patient has got tummy pain, we'll be treating the patient for the tummy pain. Right, treatment for ectopic, we have got 3 measures to treat the patient. One is, as she already started having the bleeding, so maybe we just do wait and watch. See, in these kind of scenario, admission is must. We have to be very safe. Admission is must. We'll convince the patient for the admission, and after that, what we do, we tell the treatment plan. One is wait and watch. We can just simply wait for some time and let's see. Maybe the product of conception will come on its own. We don't have to do anything, any intervention. Second is the medication. We can give some medication. Mainly, we are talking about methotrexate. So methotrexate we can give. That will be the treatment plan, that is a medication. We can give methotrexate, and that will be helpful in treating ectopic pregnancy. That will be helpful in taking out the product of conception. One is surgery. If nothing is working, we can definitely do the surgery, right? So we can definitely do the surgery and remove the product of conception. But sometime, when we do it, you might have to remove the whole tube as well, right? If the pregnancy is in the tube. What is ectopic pregnancy? Pregnancy which is not in the womb. And mainly you will see most of the cases, ectopic pregnancy, you will see it's happening in the fallopian tubes, right? So if the pregnancy is happening in the fallopian tube, so what we have to do, we have to remove it, maybe by doing the surgery, right? And sometime we may have to remove the whole tube as well. So that's also the thing. But make sure we are not missing this part, admission. So symptomatic treatment, wait and watch, medication, if needed, maybe surgery, right? Thank you.